Good evening. Thank you for watching Derek Jones Facial Plastic Surgery. I am your host, Andrea Housand. I'm also the practice coordinator for Dr. Derek Jones. And tonight we have a special guest. Dr. Jones did her facelift and some other procedures about 3 years ago. So we're going to show her before and afters from the beginning to the 1 year post-op to 3 years. So we just took those pictures last week. She still looks amazing, and we're happy that she's here to talk about her experience. Her name is Melva Morgan. Melva, hey, thank you so much for coming on with us.
Thank you for
Dr.
inviting.
Jones.
So, hey, good afternoon, good evening.
Good evening.
Yeah, it's good to be here.
So yeah, we rarely have, well, sometimes we have people that come on, patients, and we're always happy when they come to talk about their experiences. So we are thankful that you came on with us. But how did you hear about Dr. Jones? I remember, but we're just, tell the audience.
A lovely friend of mine, a friend of 22 years, introduced me to Dr. Jones and you. And I'm very thankful.
Yes, Jennifer Harris, one of our biggest cheerleaders, introduced you to us, and we're glad she did. How long has it been since you wanted to have the surgery? When was that moment when you're like, oh my gosh, I have to get this done?
That was a year before we actually did the surgery.
Okay.
I had saw a photo of myself and realized that the genetic items I was progressing in with age, I wanted to take care of. So, yeah, a year later, we booked it. And
we did.
And we did that surgery, and
Yeah.
I'm so thankful.
And I think originally you came in to talk about your eyes, and
Yes.
then, of course, Dr. Jones will tell you, like, I think this would be the biggest benefit for you.
The eyes was the biggest thing because I never wore makeup because the skin would just lay on my eyelashes. And then genetically we have the rooster chin, and I was getting that. And so I was teasing about getting rid of the rooster neck, but he said that he'd take care of that too.
And he did.
Yes,
Wait
he
till you see the
did.
photos. They are really amazing.
Yeah.
And if anyone's watching for the first time, Dr. Jones is double board certified in facial plastics, reconstructions, and otolaryngology, ear, nose, and throat. So, Dr. Jones, what do you got to say for yourself?
Well, I mean, you know, I think it's always fun to have someone come on with us, and I really appreciate it. It's a lot. It's very rewarding to do it. I mean, to do the surgery and to take care of people, and then to see the difference that it makes, you know, not only just visually, but then the stories that people tell about how, you know, just it does make a difference for people, and that's really rewarding for us. So, so we really appreciate you coming on, and it'll be a lot of fun to show your pictures. I mean, I think that's we're gonna really enjoy doing that. So, I think we're going to go and just talk a little bit about, do a little housekeeping work before we get to that. So stay tuned for her pictures, but I just want to go through where we're going to be for the next few weeks to let people know how they can come see us too. And then we're going to go right into her pictures. So let's go to our slides we have and save these dates for us, because we're going to be a few places coming up. First of all, we are in Gulf Breeze every Friday. And so if you want to come and see us in Gulf Breeze, we are there every Friday. Call us at 474-8320 or 484-FACE, 484-3223. Every Friday, we're in Gulf Breeze. This is our new location right next to Baskin-Robbins. The Hearing Center is the name on the awning, but if you look next to the door on this, it says Derek Jones Facial Plastic Surgery right there. So this is 207 Gulf Breeze Parkway. So come and see us. We've been there for over a year. We started a month or so before the hurricane.
So a year.
It's been a year right now, exactly. So it says the Hearing Center, but we have everything we need to take care of you there, and I'm there every Friday morning, essentially. Very nice facility. We really like going there, and it's been real rewarding, especially when the bridge was out, and we saved people a lot of hassle coming to see us there. So every Friday we're there. We're going to be in East Hill at Chastain's. We've been going there many, many years now. August 25th, coming up soon. You can give them a call, the 435-9935, or give Andrea a call, 484-FACE, 484-3223. If you want to come see us at Chastain's on August 25th, then we're going to be out in Pace in September at Fringe, September 22nd. We're going to be at Fringe. Again, 484-FACE is all you really need to remember because you can come see us in Pace. And then we're going to be downtown at Result. We went to Result last month.
That was our first time.
Yeah, it was our first time going there, although we've known Kim and Kriya and all the wonderful people out there for many, many years. But we're going to be back there at least every quarter, and we're going to be there Friday, October 8th, 2 to 5, right there downtown on the corner of Jackson and Alkanese, yes. So again, you can call them to schedule 466-5309 or 484-FACE, 484-3223, and get in touch with Andrea and come see us at Result downtown. So those are the places we're going to be for the next few months. And if you want to like us on Facebook and follow us, you'll get all the information there because we'll let people know through Facebook if you tend to do that kind of thing. You can always call us. Again, 484-FACE is all you really have to remember. And now let's go ahead and get into the pictures because we want to show Melva's pictures. And then we'll come back and talk about them a little bit after that. And what this is the before picture and the 1 year post-op. And you can see we did an upper and lower eyelid blepharoplasty, and we did a facelift with mid-facelift, so lifting the cheeks as well, and some liposuction along the jawline and the neck. And you can see, really nice difference, especially,
amazing.
Yeah, the eyes
Big
and
difference.
yeah, and the neck.
And when I showed you the pictures, Melva, you said, "That's my mother." You said, "That's my mother."
That's right.
And we
I
do.
see
We
my
look,
sisters.
We do. We
you
look
know.
like our.
Mhm.
It's genetic.
It's,
Yes.
it is completely genetic, and that's, we age the way that, through our genes. I mean,
Yes.
that affects the way we age as well, and so we start to look like our older relatives
Yes.
used to look. And so, but if look at your eyes, and again, jawline, neck, it really
I
looks
have eyes.
so nice. Exactly. It really brightens the eyes. We got some close-ups of the eyes in just a moment, so.
And you
but-
look natural.
I have
It
a
looks-
chin. That was the look I wanted. I did not want the straight.
Yeah.
I wanted a natural. And I
Right.
got exactly what I wanted.
I think it's a real,
It's
it's
great.
lifted. It's not, pulled or, looking unusual. I don't think
Yes.
people would necessarily look at you and say, "Oh, she had some work done" or anything
Exactly.
like that.
Because everybody, when they do look, they're like, "Did you lose weight? Did you,
Right.
did you do something?" Yeah.
What did you do to your hair?
Of course,
or
I only
something?
told them my eyes.
Yeah, well, hey, that's all right.
Well, it's not a lie.
It's not a lie.
It's true. It's true.
It's
You
true.
did do your eyes.
I do like to keep secrets.
Yes, that's okay.
Right.
Yeah, it's all right. But not anymore. Everyone's going to know now.
That's right.
Exactly.
Thank you for sharing.
Cat's out of the bag.
That's right.
Exactly.
I mean, wow.
Yeah.
And so this is a close-up on the eyes. You can see, like you said, you have eyes, and you can see your upper eyelids, and it just, has really cleaned that area up a lot to look brighter and fresher and everything. So
Yes.
now we're going to look at your pictures now. And when I was putting all this together and looking at it and everything, it's like, you look better now than you did 2 years ago or 3 years ago or whatever. Yeah,
Thank you.
the 1 year after, you look better now than you did the 1 year after, in my opinion. We just took these in the office
Absolutely.
last week, so
Yeah,
I
yeah,
feel
really,
better.
yeah.
so good. And that's why I wanted to bring you in to take the photos, just because his results, Dr. Jones's results, last.
Yeah, well, that's the thing. We always get asked, well, how long do they last? How long? I mean, here it is 3 years later, and again, I think you look
Still
better than 1
improving.
year. Yeah, I think you look better than 1 year, and definitely still look much better than before the surgery. So, and again, it just,
Very, just beautiful.
yeah, big difference. Picture's worth 1,000 words, that's for sure. So,
Absolutely.
and we were talking just a few minutes before, and I said, well, you look so much more relaxed now than you did before. And then you pointed out, of course, that you've retired since
That's
then, so,
right.
yeah. So, and that makes good sense. Yeah, that always helps too.
Just
But
let everyone think you've retired. It's done wonders.
That's
exactly,
what
yeah.
retirement does.
Yeah, retirement has
Makes you
done
pretty.
wonders. Exactly, exactly. Definitely keeps you pretty. That's for sure. Like you said, you don't have all the stress. And again, eyes. These are the most recent photos and the comparison before. And so then what I did was I had to say, well, let's look at the 1 year versus now. And like we said, I think you look every bit as good, if not better now than you did a year after the surgery a couple years ago. So still looks great.
It really does.
Yeah.
And there's still some swelling, you think, at the 1 year marks, maybe sometimes?
Possible. I think things, may
Just
settle a little bit. Yes. Yeah. It's not. I don't. Yeah. Maybe a little bit. But I mean, usually things at, a year or so, most things have changed to the point. But there's not a major difference. It just happened to look better. Maybe it is a retirement. I'm not really sure. But I do think it looks. Again, the biggest point is it certainly hasn't changed a whole lot 2 years after the surgery, 2 years after the follow-up. I mean, 3 years after the surgery, and 2 years after those pictures. So still looks great.
Yeah, it looks amazing.
Yeah, again, they look very similar in terms of the results even 2 years after these. So, so yeah, long-lasting results. Not like something's going to change in a year or 2 or 3 even. Again, still eyes look very bright and fresh and everything. So
Yeah, and the eyes are the focal part
absolutely.
of the face. Everyone's looking at the eyes, especially now we're all wearing masks.
Yeah.
But I think we're about to take a break, so please stay tuned. We're going to show those before and afters again and just talk about Melva's surgical experience. Stay tuned.
People see. Confidence in how your face looks is very important. When you want natural looking improvement, choose a facial plastic surgeon who truly listens and understands your needs. Dr. Derek Jones, board certified facial plastic surgeon, offers both surgical and non-surgical options to make you look and feel your very best. Call a facial specialist at 484-FACE or visit our website to learn more. Jones Facial Plastic Surgery, where science meets beauty.
Imagine a new kind of hearing experience that lets you hear more of everything. ReSound Lynx, the world's smartest hearing aid.
Welcome back to Derek Jones Facial Plastic Surgery Show. I'm here with Dr. Derek Jones, double board certified facial plastic and reconstructive surgeon, and our special guest, Melva Morgan. Dr. Jones did a facelift, upper and lower blepharoplasty, and some other procedures, and we were just showing her amazing before and afters from before, the 1 year after, and just last week, 3 years later. She still looks amazing, and we're happy that she is here to talk about her experience. We're back.
Yay!
Yes. So the first time you came to see us, what was the first thing that came to your mind? I'm just curious. Like
I was scared.
You were. That is very normal to be anxious,
Very common.
and it's a big decision to make.
Yes, it is.
Yeah.
Yeah, I was scared, but after seeing the photos and that, and my friends,
Right.
I knew, what type of work he would do, versus I've seen other people using other doctors, and I wasn't pleased with the results. So,
Yeah.
took that gamble, and it was the best thing I ever did.
Definitely. Everyone's always anxious, and that's normal. But we do take you along the way. We're there from the beginning to that 1 year post-op. So if there's any questions or concerns, we're there. So.
Yes, you do.
And that's the whole part of the consultation, right, Dr. Jones?
Right. I mean, the consultation, we sit down, we talk a little bit about what the concerns are. And when we met, obviously your eyes were the biggest concern, which makes sense. When we show the pictures, you'll be able to see that, that certainly makes sense. But then talked a lot about lower face and neck and the changes that you see there, and the the familial changes that you talked about that you see. And so we talked about, and that's sort of what we do in the consultation. We talk about what can we do, what do you want done, what all is involved, the recovery, the cost, all the ins and outs of what it's going to take to do that, and then put a plan together. And that's what we did. And then again, we'll show the pictures to show the outcome. But that's the part of the process, kind of coming together and making a plan and making sure we all are on the same page and have the same goals and everything. And I think that's where we were at that point. So
Yes.
yeah.
Yes.
So what was the most challenging part besides being anxious, as far as there's pros and cons, so what would you say? You were talking about the rubber bands. I think that's funny because that's everybody
That was-
says that.
Yeah, the only thing that hurt was Dr. Jones putting those rubber bands in my hair, and
Right.
it felt like he was just pulling a piece of hair one at a
Yeah,
time
right.
out.
So yeah,
The
that
short
was
hairs.
that was pre-surgery,
Exactly,
getting me
yeah.
prepped to make sure there was no hair in
Exactly.
the wherever he
there's
was
Right.
a
cutting.
a certain way you prepare
We'll
the
part
patients.
the hair for
Part
the
hair.
incisions and all that. Yeah,
But
exactly.
hey, I
Yeah.
mean-
Used a sedative then.
Right. Yeah, exactly. Yeah.
Well, I think that they might have been a little something they give you like right
Well, he had to
before,
show me
you
some
know.
kind of pain, right?
Right. Yeah. There you go. Just so
But
you
other
remember
than
it.
that, I mean, pretty
yeah.
smooth sailing.
Oh yeah, yes. The
Yeah.
healing was fast, and actually, I think I went out my first or second week after the surgery. I went and had lunch,
Okay.
and took my glasses off, and it was not bruised much.
Good.
Some I've seen where they're just black and blue eyes, and that I did not experience that.
Yeah, healing's variable.
Yeah,
everyone's
yeah,
But I did
different.
follow all your instructions,
That's
and
very
that's
good, yeah.
very important.
Absolutely.
And I was very fortunate. I had my daughter and granddaughter staying with me, so we had put the recliner in my bedroom. So I was, I was self-contained with the restroom near me, and I was able to sit up and lay down
Right.
as well.
Yeah,
Yeah.
So
that's something we go over in the post-operative instructions. You want to be sleeping propped up for a little bit for swelling, and have a good support system around you as well. It's very important.
Absolutely.
But really, we're here to show these before and after.
Yeah. Let's show the picture. We'll go to her pictures and we'll show. Then we can talk while we're looking at the pictures too.
Exactly. Wait till you see these.
So, yeah. So there's the before picture, and again, that's 3 years ago. So and this is the 1 year. This
Yeah.
is the 1 year post-op photos, and we'll go through each of these. But again, the eyes really have, and we talk about that on this show all the time, is that the eyes are the focal part of the face. So if you can make the eyes look better, that makes a huge difference, and I think that's the case with her. And then the lower face and neck is another area that, especially in your case, you tended to have the familial, the sagging and all of that, and taking some of the fullness out, and tightening the neck with the facelifting and all, but a nice big difference.
It really did. Do you forget sometimes what you looked like before?
oh
Melba?
Lord, yes.
I know when I showed
See
you.
some old pictures, and you're like, wow,
Yes,
wait,
it's
who's
like,
that?
Oh my gosh, my mother.
Yeah, right.
Yeah.
Exactly. That is really common for people to come in and say, I looked in the mirror and I saw my mother, and then,
And our mother's beautiful,
Exactly.
but we want to be ourselves. And,
Right,
and that's what I
right,
wanted.
right.
I wanted to be myself. I didn't want to be my sister. I didn't want to be my mother.
Right.
I wanted to be me.
You wanted the
So I wanted to take those things that I was given with birth away.
Right.
And I appreciate you doing that for me, Dr. Jones, because I am
Absolutely.
so pleased.
Yeah, what a nice difference. Again, just to again, soften the appearance and just, really does make a nice difference. Here's the eyes, kind of the close-up on the eyes. And like you said, you really never wore eye makeup because you couldn't really wear eye makeup because you're...
Why? You can't see it.
Exactly. There was too much.
And I wear it now that I'm retired all the time.
That's right. That's right. And then these are the pictures we took just last week. This is the before. This is the before is same, but the afters are just pictures we took just recently, which is 3 full years after the surgery. So we get that question all the time: is how long does it last? And this is a good example of how it really maintains long term. And you age from there, but it's not it doesn't. The surgery doesn't change. Your face will just change over time as well.
And again, I wanted to have a natural, I did not want the stretch look. I wanted a natural enhancement. And I think that's exactly what I got.
Yeah. And I think lifting the cheeks, if he hadn't have done that, you wouldn't have looked as natural as you do.
Yeah.
And I did, I even let this picture on the after picture, I left really long shot of the neck to show that, the improvement go all the way down to the bottom of the neck. I mean, the neck and, all you can see in the before, all the lines across the neck and all that. I mean, it's all smoothed out quite a bit. And again, the improvements all the way down into the base of the neck there. So.
Yeah. See the eyelid.
Yeah.
Yeah, you can see your eyelid, and your eyes just look like you just look so rested there.
And I have a neck.
Right, and you have a neck. Yeah, exactly.
Yeah, I think it softened my face.
Absolutely. Yeah.
I look really hard originally, but now my face looks softer.
Yeah, the outside's going to match the inside because a lot of
That too.
A lot of our patients come in and like, I'm not tired, I'm not angry.
Right. Yeah, I'm not
but
upset about
everyone
anything.
Thinks I am.
Exactly.
And it's just, I'm not. Just fix me, Dr. Jones.
Yeah, I think we do. We definitely want that congruence where people just look the way they feel, and they say, "Man, I feel a lot better than I look." And so, that this projection now. I mean, people look at you and they say, "Wow, you're rested and you're, feel better." I mean, you just look like you feel better anyway. And here's again the close-up of the eyes 3 years later, and again, it's still very, much more, like, the eyes are just so much more accessible and they look so much better. So, and then, like I said, just kind of for fun, we looked at the 1 year versus 3 year to look and see how that looks, and you can see how well things have held up over the past 2 years. Well, the past 3 years, really. I mean, going from, but this is looking at 1 year results to 3 year results. And if anything, when I was looking at it, I thought it looked better, at least as good or better than 1 year. Yeah.
I agree.
And again, it just natural looking, and you wear your hair short, but I mean the incisions really are not an issue. I mean, they're difficult to see. That's one of the biggest compliments is the hairdressers when they say, yeah, I mean hairdressers are a big fan of ours, and I think they see all the incisions from everybody everywhere, and I do think we take a lot of effort to make incisions not apparent. So this is the 1 year to 3 year. So again, we don't expect to see much difference, or if anything, people might expect to see some change and not look quite as good at 3 years, but I certainly think it's held up great, and again, long-lasting results.
Definitely.
And again, the eyes, close-up of the eyes still look great. So really, what a nice improvement over that time.
Yeah, looks so good.
So what's your favorite thing about having the new look? Is it just sort of the way other people tend to, I mean, do you,
Yeah,
do you notice a difference
oh,
in the way
yeah.
people sort of treat you, the
Yeah,
way people?
they do a kind of tilt the head look at me, you know,
Mm-hmm.
but I also changed my color of my hair. I let my
True.
hair grow natural.
Right.
So I think between the two, they're kind of like, huh.
Right,
you
yeah,
know,
what
not-
is it
not-
going on? Right,
doesn't
right, right.
know exactly what I did, and I don't
Right.
tell either.
Right, right. That's right. That's right.
That's a common thing that patients will do. They might do something different with their
To the hair.
hair afterwards, or if it's a man, Dr. Jones will say, grow your beard out, and then while you're healing, and then shave it, and then I'll be like, whoa, you know,
Makes
Exactly.
you look
look
so
so
young.
young.
Exactly.
Yes.
So-
Oh, I feel young too.
yeah.
I feel young.
Does it make? I mean, does it make you feel younger to look younger? I mean, does that make you, or just you felt that way anyway, and you just wanted to look that way? You felt.
Well, taking the things that I had, the chin and that just really made me feel that I could age nicely.
Right, right.
You know, without having a full reconstruction. You know, I
Right,
just
right.
feel better about myself.
Yeah, yeah.
Not having to know that I'm gonna have this extra skin flopping in the wind. And
Right. Yeah, yeah.
And there's really no other way to address the chin and the neck than what Dr. Jones does. That's a facelift. You can't do Kybella or PDO threads are not going to give you that result. Not these long-lasting.
Not this type of
results.
result, and
Yeah.
not with the taking away the fullness as well. And the eyelids is the same way. You can't get this kind of result in the eyelids without doing surgery.
Right.
So.
I think we're about to wrap it up, but if you are interested in seeing Dr. Derek Jones, please call me, Andrea, his practice coordinator, at 484-FACE. That's 850-484-3223, FACE, and we will get you in to see Dr. Derek Jones. Thanks so much for watching, and good night.
Thank you. Thank you.